Welcome to the Long COVID podcast with me, Jackie Baxter. I am really excited to bring you today's episode. Please do check out the links in the show notes where you can find the podcast website, social media and support group, as well as a link to buy me a coffee if you are able. You should not rely on any medical information contained in this podcast and related materials in making medical, health-related or other decisions. Please do consult a doctor or other health professional. I love to hear from you. If you've got any suggestions or feedback or just want to say hey, then please do get in touch. I really hope you enjoy this episode, so here we go. Hello and welcome to this episode of the Long COVID podcast. I'm really happy to have occupational therapist Dr. Jenny Ceolta-Smith with me today. We've got so many employment questions surrounding long COVID, but today we're going to chat a little bit about leaving employment and the options that people might have before and after that. So welcome to the podcast.
Oh, thank you very much. It's good to be here today.
So would you mind starting off by introducing yourself a little and just saying what it is that you do?
Yes, so as you've mentioned, I'm an occupational therapist by profession and I have long COVID. I've been ill since March 2020. I have a professional interest and experience in vocational rehabilitation. So that really is around everything to do with getting somebody back to work or staying in work or starting new work. I'm a professional member of the Vocational Rehabilitation Association. And I'm also a researcher, and my research focus predominantly has been on the Department for Work and Pensions, their employment support for people with health conditions. And I've also worked in a Department for Work and Pensions employment support provision a number of years ago, managing a condition management programme. And I've also more recently, before getting COVID, had a part-time role working alongside work coaches in a job centre as an occupational therapist. Perhaps I should also say that I'm a member of the Long COVID Support Organisation, which is a charitable organisation now. And my advocacy work there is in the employment group. And people on Twitter may know us through @LongCovidWork. So we're doing a lot of work there around campaigning to help people stay in work and the benefit system.
Fantastic. So it sounds like you've got a huge amount of experience around all of these areas, and now having long COVID as well, you've got that side of it too. Unfortunately, I guess.
Yeah, and unfortunately, like many others, I've lost my job through long COVID. That was last October. I don't know about you, but I do get the years mixed up because 2 years seem to have kind of rolled into one. So I did lose my job, but technically I agreed to leave my job. And that's something perhaps we're going to be sort of talking about today, what happens and the dilemmas that people are currently experiencing as they approach job loss.
Yes, absolutely, because it is such a big issue with so many different people and in a lot of different ways as well, which I think is kind of possibly part of the problem why it is such a big issue, because everybody is so different. But I think, today we're going to talk a bit about when somebody has sort of realised that they are going to leave their job. So what are the options when somebody's realised that that is something that's about to happen?
Yeah, I think that's a really interesting question because people aren't necessarily getting the option. We have a member in our employment group around the nursing situation at the moment. We're hearing lots of people actually being dismissed. So it's not necessarily that someone has an option, although there's a lot more to be said about that. I think one of the dilemmas facing people at the moment that's being reported to our group is whether somebody should wait to be dismissed when it comes to that kind of stage. I mean, there's a lot of work before that. We would hope people would be able to remain in their job. But the dilemma is, should I wait to be dismissed or should I resign? And this is a common dilemma that people are coming across. And I think that's something that might be worth us kind of chatting about a little bit, really, around what advice we've been given when we've sort of asked people about that as well.
Yeah, totally. So, like you say, do you just get out of there and save yourself the sort of indignity almost of being dismissed? Or do you just hang on till the last minute? Yeah, what are the pros and cons, I guess, of the two options?
Yes. So, as I say, people are coming to us asking or telling us about this dilemma. We did seek some general advice from one of our collaborators. That's one of the national law centres. Now, the advice is really, it has to be based on an individual's circumstances. And so they do need to seek legal advice around that specific to their situation. But having said that, the general advice that we've been given is not to resign. And the reasons for that are that somebody may want to take a case after they've left their employment. So it may be that somebody is having lots of problems, they've tried everything to stay in their job, and then they realise that they're being pushed towards dismissal, so they think that they'll resign first. And after they've left, they may then realise that they've been subject to disability discrimination, for example, that no reasonable adjustments were offered, or, a whole range of factors. And, it can be harder then to make your case and perhaps think about going through ACAS, I'll give you the link to that, for kind of raising those complaints and going through conciliation, or maybe going to an employment tribunal. So that's one of the kind of things that people are facing, really, is this huge dilemma. And also linked to that dilemma is, why is somebody thinking they should resign? And what we're finding is that people are thinking that if they resign, their chances of getting work more easily is better if they resign rather than being dismissed. And I do think that is a myth that we need to bust, really. If somebody is dismissed, they are still going to be employable. Obviously, we've got to bear in mind their current health and how long COVID is impacting their capability to work. But just because you're dismissed, it doesn't mean to say that an employer isn't going to want you. And what I'd like to kind of share in that is, in my history, I was working for the NHS back in 2007 when my job was terminated rather abruptly, even though I was working full time, because I'd had a work-related injury. And I agonised for quite a long time when I had to leave that job, when it was enforced upon me, as to who was going to employ me. And it is quite common for people to really become quite anxious and worried if they've been off sick for quite, an extensive period of time, that they really worry about their sickness record and see that as a barrier to future employers. And I would just like to encourage people to say that, in my career, that hasn't stopped me getting work. And it's not stopped me now, even though the work that I'm doing is quite minimal. I'm not working full time, but that certainly isn't going to prevent me from approaching employers in the future.
We'll be right back. I'm interrupting myself for a second to tell you about long COVID breathing. The fabulous Vicky Jones and I have teamed up to bring you long COVID breathing. We are both passionate about sharing our expertise and experience of the breath and how incredibly helpful that can be with long COVID. We've worked together to develop a course that is specifically tailored to those with long COVID. It's a 6-week course with 12 sessions, all delivered online. The community feel and learning that we're all sharing is such a joy. To find out more information and to sign up for our courses, workshops and other shorter sessions, please check out the link below, longcovidbreathing.com, or email longcovidbreathing@gmail.com to start your breathing journey with us. Yeah, Yeah, that's really useful to hear from a personal perspective as well as a professional one, because obviously you have both. um, but this idea of if you resign rather than get dismissed, it would be harder to possibly follow it up in terms of unfair dismissal and that sort of thing. So say somebody has, been dismissed from their job as a result of long COVID, and they think that they might have been done so unfairly. What are their options there in terms of fighting it, I guess?
I think hopefully if people have got unions, they will have had some support from the unions, although we are aware, our group is aware, that there are some challenges in getting union support. But obviously that would be a point of call as well, because the unions can support with cases. There is ACAS, and I will provide the link to that, which is the organisation where people have to go through that organisation if they are going to raise an employment tribunal case. They have to go through there and go through conciliation first, and that is a process. There are the national law centres, which can provide advice as well. We do collaborate with GM Law, so I am aware that, for example, for that agency, if you are in the union, you may not be entitled to access that support as well. There's also the Equality Advisory Service. I can't quite remember its full name, but I'll give you the link to that, which is an organisation where you can check out whether you have been subject to disability discrimination. So you can get support there, and they do have letters, templates, and things like that, and a very helpful helpline, as does ACAS. Their helpline is very good, and they are confidential as well. So just going back to that in terms of my own experience, as I sort of mentioned at the beginning, that I actually agreed to leave my employer. So I didn't raise any grievances before I left. So if we kind of step backwards a little bit, there is the option before somebody actually leaves to raise grievances. And again, ACAS can provide information and advice about that process. And organisations should have policies on grievances as well. I would like to say that in my own experience, I sent a very long and detailed 8-page letter to the Vice Chancellor of my university, the Director of HR, and the Dean of the school that I was based in, shortly before I left my employment, to raise my concerns about how I was treated, and that I believed I had been subject to disability discrimination. I was told the day I sent that in by email I would receive a reply. That was in October last year, and I've yet to have a reply. So I think if you are going to raise something while you're still in work, then the policy will dictate the timeframes that employer is required to respond and how they need to deal with that grievance that you've raised. In my case, it was very a short time window, really, before I actually left. But I think that is a concern. And when we're thinking about how we cope as individuals, when we leave work, either we agree to leave, we resign, or we are enforced through dismissal, we do have to think about how we are going to come to terms with that, because it is a huge loss. And there may be factors such as bullying, coercion, a whole range of factors that have happened in the workplace. And when you're ill and you're having to come to terms with your job loss, huge financial implications. You're worried about your career. You're worried about how you're going to pay the bills, when you're going to be able to work next. There's an awful lot of energy and emotion that's required. So I don't know if I've fully come to terms with the way my former employer responded to my situation. There were positives, but there were also negatives. And because I haven't had a reply from my former employer, I don't think I've quite closed that off yet and dealt with that.
Yeah, that's a really good point actually, and it's almost like there's no closure for you, and that must be quite difficult.
Mm.
See, just going back a wee second, you mentioned people being able to find out if they have been subject to some sort of disability discrimination or unfair dismissal or whatever. How would somebody know about that? Because I don't think I would know if that was something that had happened or not.
I mean, ideally, we would hope it isn't happening. We hope that with, all the good work that's going on by so many organisations, including the work of our group and long COVID work and the Society of Occupational Medicine and the CIPD, for example, and the TEC Equality, we would hope that wouldn't be happening. But unfortunately, we do know that there are lots of problems and challenges. People aren't being allowed to, for example, work from home as a reasonable adjustment because of their long COVID. So I think, yes, it's an interesting question. How would people know? And I think that's where I would, at the moment, I think, advise to contact these helplines that I've spoken to you about, because every situation is unique. Every person that has long COVID, the type of work that they're doing, the type of employer, what reasonable adjustments and things that they might need or require. And they're under the Equality Act. It's not necessarily that an employer will have to respond to all of those things. So I think there's also support from, occupational health, and they can actually explore that with somebody when they have an assessment, and look at those and discuss what might be helpful. The GP can also look at some of those aspects with the fit note. So there will be things along someone's journey when they've engaged with people that are helping them to stay at work, that might alert them to think, actually, my employer could have done more here for me. But I think, hopefully speaking to those helplines and finding out and getting support early on will hopefully avoid the kind of scenarios that we're talking about today, that are more when you've kind of, things haven't worked, or for whatever the reasons you decided that you are going to leave.
So the grievance procedure, which would be probably before you left, and then the tribunal, which would be after leaving. I mean, we all know that long COVID symptoms are definitely exacerbated by stress. And if you were to go to an employment tribunal or raise a grievance, that sounds to me quite stressful. What would be your advice to somebody who was thinking about it, but thinking, is it worth it?
We don't know yet in terms of employment tribunals. We are following cases that we are aware of closely, so we do know that there are cases happening. But this is part of the problem, that you are right in the sense that, from what I've gleaned and our group's gleaned, is that it's an awful amount of work. Now, that's not to put people off, because I think what we're very much trying to do in the long COVID support employment group is to find support for people, which is why we're working with GM Law. Now, recently they have just done a webinar which has been recorded, and we will be putting the link on our long COVID work website, which actually, I haven't seen it, but it talks through the process of, if you're going to an employment tribunal without any representation, what would that be like? So I think if anyone is going to be raising grievances or going through conciliation, which is the process you have to go through with ACAS before you can go to an employment tribunal, then you probably want to kind of, chat it through with somebody, and speak to the helplines to find out what the implications are. It is a tremendous amount of work to do. And I think as well that to be prepared, that if you go through conciliation, you'll have somebody, I've forgotten their title, from ACAS that actually you or your union rep responds to. They will be speaking to your former employer's solicitors. because essentially you're raising, say, for example, you're raising a claim that you've been subject to disability discrimination. You're going to have to explore what kind of, or what you're wanting from that conciliation, kind of financial compensation you're wanting, whether you're wanting your job back, for example. So, you've got to be mindful of how that your former employer's solicitor is going to respond, and whether you are strong enough to actually take that response yourself. For example, they may say, there's no way you were discriminated against. And, they might send you this long email that's pretty hard to read, denying any of your claims. Or you may choose to go through conciliation and you don't actually speak to that ACAS worker, but your union rep does, for example. So I think it can be a tremendous burden on yourself, even to raise a grievance, to be raising a grievance, say, for example, about your line manager, and you're still in that work situation. So I think I would seek support, peer support, and try and get as much information as you can as to what do you want from those outcomes and what's best for you. In my situation, I did speak to ACAS a number of times when I was still employed. There was one time with my employer where I'd asked if I could reduce my hours to my work to 2 days a week instead of 4 days a week, and do that for kind of 6 months to a year, because I knew I wasn't able to work my usual hours. And I asked if I could work from home. Now, my former employer said, yes, I could reduce my hours, but they would not accommodate working from home. But they wouldn't give me that decision. I forget exactly now, but it was going on for like 8 weeks. And I contacted ACAS, and ACAS said I should raise a grievance. And so going back to your kind of question, what do you do? I chose not to raise a grievance because I felt that would be detrimental to me at that time. And I did have a union rep who was supporting me, so I didn't raise a grievance. But actually now, if I reflect back, would that have been good for me to raise a grievance? I think it probably would. And I think from memory, from our group's discussions we've had with legal experts, I think the advice is that it may be more beneficial to take out a grievance if you are going to actually pursue conciliation and employment tribunal. I think that is kind of one of the messages we've kind of picked up in, I'm not a legal expert by any means. I'm learning through my own experience, but it is exhausting keeping a record of everything. One of the podcasts that I was involved in with Queen Margaret's University, I talk about keeping a record of all your meetings and outcomes with work. And if you are going to pursue anything around, a grievance or taking it, to conciliation or employment tribunal, then these records are going to be really important. So, keeping a record is good practice, really, while you're trying to work while you're ill, but it's not necessarily easy to do.
Yeah, that's a very good point, actually, making sure that you've got your evidence almost. And I suppose making sure that that's in writing as much as possible, because I'm sure a lot of people have conversations on the phone, which then they can say that they had that conversation on the phone, but there's no evidence of it, is there?
A little tip for that, and this is actually really important for us with long COVID, because some of us do have memory difficulties or cognitive dysfunction. So I would always, after a meeting, bounce something back to my line manager and say, you can even say something like, thank you for the meeting today where you said I would, or can I just clarify that you said in the meeting today I would be expected to. That way you've got a record, but it's also then saving that email, so it's, how do you keep the simplest process that you can? But you are right, it is much better to have something in writing. And also, in fairness to employers, we can misunderstand things. So actually clarifying that is a positive. because, it may be that we've totally misunderstood and something isn't as detrimental to us as we thought it would be. There is also, what's just come to mind, another source of help, potential help, and that is if people have house insurance that has legal cover. So in my situation, I did contact my insurers and I did get free legal support, and they did evaluate my case. And in my situation, I could have more easily gone through to an employment tribunal if I'd have raised my case earlier. Because importantly, there is a strict time limit that you have to raise this issue, and this is all on the ACAS website. It's within 3 months and less 1 day of the time that you believed you were subject to discrimination, say, for example. So there are sort of set timeframes that are very, very short in my view, especially when you're ill. But the legal cover is quite useful. However, what I've gleaned from that is that in order to get further help with that legal side of your house insurance, is what seems to be the case is that you have to have a 51% of probability that your case would be won for them to kind of proceed helping you. And I think that's similar in terms of the unions, although again, I'm not an expert. So the key message really is to seek advice from the experts around these issues. So you've got the national law centres, you've got the unions, you've got ACAS, the Equality Advisory Service, and maybe somebody from your house insurance as well.
Yeah, that's really a useful tip as well, actually. So find out, seek support, seek advice, and do it as early as possible. We'll be right back. Hey there, I'm just jumping in for a second to see if you're enjoying this episode. If you're finding it useful, maybe you would consider sharing it somewhere, a friend, a group, or even on your Twitter feed. If everyone was able to share just once, we'd be able to get this information out to even more people who really, really need it. So please consider sharing somewhere if you possibly can. I hope you enjoy the episode, and thank you so much.
Definitely. And I think, again, these are all things that are really hard to do when you're ill. So maybe it's breaking them up into, small tasks and finding out. But that is something that hopefully we will be able to put more information on our Long COVID Work website. And also, just very timely, several of us are meeting with a firm of solicitors tomorrow about these issues. There is interest from lawyers and solicitors, legal experts around these issues. So we're hoping that we will get more support and that workers won't be disadvantaged because they're ill. And, we do know that unfortunately some employers aren't doing the right thing. So we want to kind of be able to provide as much information, and many of us are learning, as we go, drawing on our own experience and the experience that other people bring to the group as well.
Yeah, that sounds positive though.
Yeah.
I think you touched on it earlier. And if you've lost your job as a result of long COVID, whether you resigned or whether you were dismissed, it must be quite a traumatic experience, coupled with the fact that you've lost your health and you're ill and all of those things, and you must lose quite a lot of confidence in yourself and your ability to work and your ability to provide for yourself or anybody else that you're having to provide for. And I guess you've maybe been through some of this yourself. How on earth do you kind of build yourself up again after that?
I think it's exceptionally difficult for me on a personal level. And I've said this a lot when I've spoken to people about it, is the advocacy work is one of the primary things really that gives me purpose and meaning. And it's called advocacy work. And so, it is a form of work for me. It gives me the same kind of structure and routine as paid work would, although there's a lot more flexibility in it. And I think working with people that are in a similar boat, similar position to myself, where we understand the challenges we have, and we're in a new world and way of working. So, we learn together and we support each other. So I think if I didn't have my peers with long COVID, particularly those in the employment support group, because we all have issues around employment in that group, then it would have been much harder for me to actually cope and adapt to that job loss. I also had 3 months of getting used to it because I agreed to leave. Although I wasn't at work, I had to give this 3 months notice. So I had 3 months where I didn't have any money from my former employer. I wasn't in touch with anybody. It was this kind of 3 month sentence really before I could finally say I'm no longer a worker. And importantly, within that, it's a key message today is for people to be aware of the benefits that they may be entitled to, because the financial loss is huge with employment loss. And so, it's really important that people feel they've got enough information as possible around claiming benefits that they may be entitled to.
Yes, absolutely. And I'm sure there are links that we can put in the show notes for help with benefits and things as well. You touched on it with the advocacy that you've been doing, and I think a lot of it is about finding some sort of purpose, isn't it? We're obviously all ill and we can't work. That's why we've been dismissed or whatever. But yeah, finding something that we can do within our limits that will give us that sense of purpose and having something to do, certainly for me, has been a big thing.
And definitely, and I think not just for the reasons of becoming employed in the future, it's very important for us all to have something that we find meaning in. But having said that, I think it's really important that whatever people are doing, they can think about the future and think about the transferable skills that they're acquiring. So I know earlier on we were sort of saying about yourself, doing the podcasts and the skills you're learning there. We're all becoming much more competent in Zoom meetings, which is a new way of working. And so there are many skills that people are probably gaining while they're not in paid work that will actually be really useful for future work. So I think that's kind of a tip really, is to kind of reflect on that when you get time, and even just having a little notebook where you think, right, I've learned this new skill today. That is a way I can sell myself in the future to a new employer. In my advocacy work, I'm kind of having a session with one of my peers, Kirsty, who's brilliant at all the kind of web type site-based stuff. So we're going to be learning how we can update the long COVID work website this week. So I think there's lots of skills people can add to their CV, and thinking about different forms of work in the future as well, that maybe they're not going to go back to the work that they have, had to leave or were forced to leave. There may be new job opportunities that they can take advantage of.
Yeah, that's a really good point, because we are all learning a lot of new skills in lots of different ways. And I think a lot of us maybe don't realise that we're learning them either. I'd never used Zoom until lockdown. I used other online platforms, but, and that in itself is a skill. And now I don't think a day goes by where I don't have a Zoom meeting.
Yeah, definitely. And I think it's about confidence as well, because, research around how people feel after they've lost their job, it's not uncommon for people to lose their confidence and their self-efficacy, and to have that belief, who's going to employ me again. So I think all we can kind of retain and kind of reflect on, that actually we've got a lot to offer future employers, and we're learning an awful lot about what it's like to live with a long-term condition as well. That there's a lot of other forms of work that I could engage in now to what I wouldn't have been able to do in the past as well. And I think that's something, that there are different forms of support for people around changing careers, different charities that may be able to help people with long-term conditions, or now, I define myself as disabled by long COVID, so there are different options for people. I'm less aware at the moment of what support is going to be available from the job centre and in terms of support to get people back to work. And that's something I'm going to be looking at closely next as well, and that we have raised as a group.
Yeah, fab. So, and you mentioned it happened to you earlier with you had your 3 months notice, or, if somebody was on sick pay and they ran out of sick pay, for example, and can't return to work, but they're still technically employed at that time. So would they be eligible for benefits at that point? What would the sort of procedure there be?
Yeah, so in my case, my employer actually sent me a letter. It did say essentially I'd run out of statutory sick pay and that I was potentially eligible to claim benefits. So again, I'm not a benefits expert, and everybody's situation is individual and there are different rules. But in my case, I was able to claim new style ESA, the non-means tested ESA, because there are rules, around if you have a certain amount of saving or assets. So I was able to claim that, which for me was £74.70 a week. And I would potentially, if I could claim that for up to 1 year, and that wouldn't matter if my partner had an income or I received money when I left work or anything like that. So that I did claim that. The process for me in comparison to claiming PIP was pretty straightforward. You do need a fit note from your GP, and I'm talking about England now, so there may be slight differences in Scotland, for example. But then I had to upload my fit note digitally, or I believe you can send it in. And then at a later stage, I was sent some paperwork, a medical questionnaire, which did take some work. And I was told I would have a work capability assessment, but I didn't receive any notification for that. So that was something I could immediately access. And it was pretty straightforward in getting the benefit. I did have to have a call with a work coach at the job centre as well before they paid that benefit. And that worked reasonably well for me in terms of some income. So I would really encourage people again to look at what they might be entitled to, because there's a lot of fear around the benefit system, and obviously a lot of people are struggling to apply. So there are support services. I would encourage people to ask at their GP surgery for support. There may be wellbeing services or welfare rights workers attached to a GP in some areas. The GP may be able to refer on to something around social prescribing, where the social prescribing link worker may be able to know what local support services are around for welfare rights and support. There may be support in the long COVID clinics around benefits for people. If people are living in housing associations, they may have welfare rights workers. And also it may be worth checking the local authority to see what support they have around benefits. And if there's local services you can find, I would look at Citizens Advice and contact them. Our long COVID support employment group are doing some work this month in March. We've got a small working group together that are working on the benefits, and we will be producing a much more specific resource pack and hopefully some videos if we can. So we will kind of have much more easier links. But the overriding key message for anyone is please seek expert advice when you make any claims about benefits, and really get that support with completing any claim forms, because it will potentially prevent you from being denied that benefit if you're entitled to it. So that was one benefit, the New Style ESA. The other benefit that I claimed was PIP. I do believe that's going to be slightly different in Scotland. So PIP, I'm afraid I do have to be brutally honest. The word that comes to mind is nightmare, horrendous process. But I really want to encourage people to apply for that and not to be put off by the numerous barriers that we know exist around PIP, because I was awarded PIP. I didn't think I would get it. It took a long time from the point of claiming it to having the assessment and then being awarded it, but you are backdated the payment from the time you make the claim. And we are looking into this as a group and with other organisations that are more expert in this, such as chronic illness inclusion. But I think, the strongest advice is get that support, get help writing the claim questionnaire, and also try to start keeping any evidence now. Again, when we're ill, it's always kind of everyone's asking us to keep, a diary for this, a diary for that. But we need a folder or some system that works for us to keep all the letters that you're sent about medical or healthcare professional appointments. If you're having any appointments, always ask for a copy of any reports and any letters and keep them in your file, because with PIP, you do need the evidence to support your claim. And that can also be evidence from, a family member. They could write a statement. I got my partner and stepson to write a statement to go with my application. So try to break the claims process tasks down into small spoons, teaspoons of time that you can actually get the claim done. And as soon as possible, make that call. You do have to call, I believe, for PIP still, but it's certainly in England, it's online now, I think, the application. But there are some excellent organisations out there that will support people. And PIP is not means tested at the moment, and you can work with PIP as well. So that's available to people. But of course, there are other benefits that people can get. So if you do get awarded PIP, then you may be eligible to council tax reductions, vehicle tax reductions or exemption, blue badge, and other things around housing and travel discounts. Certainly in England, I believe the blue badge is Wales as well. So there are a lot of added benefits when you get awarded PIP. So that is worth bearing in mind. And also universal credit is the other benefit. Obviously, we're talking about adults now, and there's also carers allowance that maybe some people are eligible to as well. So again, get that advice because the rules do change. I would like to just highlight about my experience with what's called permitted work. So I was receiving a new style ESA, and there are rules that allow me, with discussion with a work coach at the job centre, to undertake up to 16 hours of paid work per week, as long as it doesn't exceed £150 before tax. So I knew about this and I thought, this is great. This is a great opportunity for me, because I still feel very ill and my abilities fluctuate, that I could actually become self-employed and engage in work while I still had that kind of safety net of ESA, almost like a very gradual phased return to work with a benefit. And I did that in December, and that worked. And the paperwork was simple, really, to complete when I'd done a few hours work and was paid for that. But come January, I was fortunate to get some work where I was going to be earning more than £150. It was 6 hours work. And I notified DWP about this, because you do have to notify the Department for Work and Pensions anytime there's a change in your circumstances, which, to be fair, is a real nightmare as well, because you do wait on the phone at least an hour. And since I notified them, they've put me into a category of suspension. So I've received no benefit. But actually, they still paid me in January, even though I told them I was working. So I may actually have to pay them that money back. And they've suspended my ESA. So I've had no benefit now. And I only worked those 6 hours in January. And I cannot get a response from the decision makers. So I do warn people about permitted work, because I do think it could be a very valuable opportunity for people to test out work and keep their benefit, but really must check out the rules with the work coach, and again get advice before they undertake that, just in case their benefits are suspended in that process.
Yeah, that's a really good point there. Yeah, it sounds like a minefield, but I think something you mentioned earlier, it was that a lot of these benefits you can still apply for while you are still in employment. I think that's probably worth highlighting, because a lot of people probably don't realise that, that you can be in work and still be eligible for certain things.
Yeah, definitely. And I think it is, we have to be honest, it's not easy. There's stigma around it. There can be, challenges to it, but ultimately, that system should be there to support people. And if we don't make those claims, then our lives are going to be at more detriment for it. And, people definitely need that money. And I think it's the PIP that I'm hearing more, that people aren't claiming because they fear they're going to be rejected, and that all that effort is going to make them worse, and then they're not going to get it at the end. So I think with the support, people are more likely to get it, because we do know from the appeals, I forget the percentage now, but it's a high number of people that do get awarded PIP at the appeals process. So that's why I'm really giving that message. Get the advice when you make the claim, and make sure your claim is as strong as possible. So when you have the medical assessment, you will meet the criteria.
Yes, because it would be a lot easier if you didn't have to appeal.
Yeah, definitely. Yeah. So I think it's worth making the call and finding out exactly what sort of support will be there for you. There may be some support that you just don't know is possible.
I guess it's always worth asking the question, isn't it? If you don't ask, you don't get.
Definitely.
Fantastic. Well, thank you so much, Jenny, for talking to me today. We've covered so much that is incredibly helpful, and I feel like we've barely scratched the surface. So hopefully we can do a follow-up about some other employment topics in the future. So do get in touch with all your employment questions. So yeah, thank you so much.
Oh, thank you. That's great.
Thank you so much to all of my guests, and to you for listening. I hope you've enjoyed it, or at least found it useful. The Long COVID podcast is entirely self-produced and self-funded. I'm doing all of this myself. If you're able to, please go to buymeacoffee.com/longcovidpod to help me cover the costs of hosting the podcast. Please look out for the next episode of the Long COVID podcast. It's available on all the usual podcast hosting things. And do get in touch. I'd love to